This Good to Go segment is sponsored by Corewell Health.
Men's health is important, but often overlooked, as guys tend to be less likely to talk about how they're feeling, and not to stereotype, but I've heard they're also not as vigilant about routine screenings and physicals. Dr. Conrad Tobert is a urologist and men's health physician at Corewell Health, here to share some important reminders for men. Hi, Dr. Tobert.
Hey, how are you doing?
I'm doing well. Am I right, though? Are men kind of bad patients?
I wouldn't say they're bad patients, but we oftentimes are less frequent to see a doctor when something's bothering us, and we let things drag on a little bit more than they should before we get them evaluated.
All right, well, let's talk about some of the most important screenings for men. What are they, and at what age should they be done?
There are a variety of issues that men have to deal with. As a urologist, I focus primarily on testicular and prostate cancer when it comes to screening. For testicular cancer, it's recommended that once a man hits puberty, they perform a monthly self-testicular exam looking for any abnormalities. With regards to prostate cancer, it's recommended that a man at the age of 55 through the ages of 70 get a yearly PSA blood test that can be drawn by their primary care provider to look for any abnormalities there. But it's also important to know that men's health isn't just prostate and testicular cancer. Mental health, cardiovascular disease, and diabetes, to name a few, are also things that a primary care provider can be helped with to do screening.
All right, let's drill down though a little bit on prostate cancer. How common is it, and what is the best way to avoid getting prostate cancer?
Unfortunately, prostate cancer is very common. 1 in 8 men can get prostate cancer in their life, and in some studies, it can be as high of a rate as 1 in 6 men. If people have higher risk factors, specifically a family history or a race, specifically African Americans, are more likely to also be diagnosed with prostate cancer. Those folks are more likely to get that rate than 1 in 6. Unfortunately, there's no silver bullet to cure people or prevent prostate cancer from happening. However, a recent study showed a heart-healthy diet helped improve the likelihood of patients developing prostate cancer.
Okay, that physical, we call it an annual physical. Is that how often men should be having that done?
I completely agree. A yearly physical with a primary care provider is very important. They're able to take a look at the entire body from the heart and lungs to all the way down to the toes. As a urologist, I do recommend a yearly digital rectal exam to feel the prostate and palpate for any abnormalities, specifically in that range from 55 to 70.
So that physical and the experience of the relationship with the patient and the physician, critical, I know. But why is that so important to maintaining good health, all in all?
When we find diseases early, or when we find something that is a troubling issue early, we are able to address it in a more effective way and actually prevent it from getting worse. Taking care of something when it's gotten way out of control is much more difficult than when it's in its early stages. And that's where screening comes in and helps detect things early so we can cure things and prevent it from causing a long-term issue.
Any other aspects of men's health we should be addressing long as we're at it?
I mentioned a couple things a couple minutes ago, specifically mental health, cardiovascular disease, and diabetes, all issues that every man also should take into account. And that's where I recommend people see their primary care provider. A good relationship with a doctor that sees you on a regular basis will help keep you healthy and promote long-term longevity when it comes to just staying active and the type of person you want to be.
All right, I know folks can find a listing of primary care providers on the Corewell Health website. So thank you for that. Some good information, important reminders. Thanks, Dr. Tobert.
Thank you. Have a good day.